The figures are quite astounding. It's like over 75%. So 3 out of 4 adults have undiagnosed or untreated gum disease. You can see that definitely the difference, and it causes other issues like tooth loss and quality of life for the adult population here in Vietnam, and even amongst the healthcare professionals. So in the medical community, even the dental community, people don't really give enough weight to it, which they should, because it's difficult to manage. It's not popular. It's time consuming, and obviously it doesn't pay well.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Dr. Albert Viet, who is a U.S. board-certified specialist in periodontics and implant dentistry. He is managing director of Premier Dental, a highly regarded dental clinic chain based in Ho Chi Minh City. He was born and raised in Australia, where he went to dental school. He then served as a dental officer in the Australian Army and in places including Iraq. After, he completed postgraduate training at Columbia University in the United States, as well as teaching and conducting research there. So, Dr. Albert, it is great to be here with you today. We're going to talk about your journey to Vietnam and experience in dentistry since you got here. And so you have such an interesting and international background. How did you end up in Vietnam?
Well, thanks, Beth, for having me on your channel here. So I'm born and raised in Australia and practiced there for many, many years. And I actually ended up in the States because I met my wife. She's from New York, and we decided to move over there and at the same time pursue my studies and specialize. So I did my specialty postdoc training in the States, and I stayed there for a few years. And Columbia University asked me to stay back and do some teaching and research. And the plan was always to head back to Australia, where I had everything all set up, and managed to do a pit stop here in Vietnam because my wife's family is here, and was meant to spend like a year or so, and 6 years on, we're still here. And so we fell in love with the country, saw many opportunities, especially in the healthcare space, which we'll get into. So we're happy we're settled, and we'll be here in the medium to long term.
Okay, great. And so you said that your wife's family are from Vietnam. Is your family originally from Vietnam too?
Yeah, so my parents are from Vietnam. Then after the war, they migrated over to Australia, and that's where they had me, and I grew up. So my roots are in Vietnam, and I always felt some force to draw me to serve the Vietnamese community. Always something familiar, and there was a chance for me to give back to I guess the homeland, parents' heritage.
And what did your family think about you coming to Vietnam? Were they excited or concerned?
So it's funny because all my family and friends, they're all back in Australia, and it was a difficult decision to make because everyone it goes against the trend. I think the trend is everyone is seeking to leave the country for greener pastures, and to buck the trend and come back to Vietnam, which is still a developing country, and to work here and settle down is actually very few people do that, and it was a decision that I guess was kind of hard to explain to family. They really didn't understand the reason why, but we've come to peace, and they really can see the impact we're making in Vietnam, and so I think it's the right choice. And so family, they're supportive now, but initially it was a bit of a difficult thing to explain.
I see. And like, what in particular was it that drew you here? Because I'm sure you could have made a lot more money in Australia or certainly the US. So what is it about here?
So it's a developing country. I think Vietnam is well known. It's in the middle and affluent class. It's the fastest growing in the Asian Pacific region. So we saw 6-7 years back that there was something happening, and the country is very dynamic. A lot's happening, a lot of development, and I saw a bit of a gap in the healthcare, particularly in the dental space, where I could actually offer something to the Ho Chi Minh City and beyond, and bring my expertise and my take on healthcare. So that's actually what drew us to stay and make a make a bigger impact, as opposed to if I went back, there's plenty of healthcare professionals and specialists like myself. But to come back with my training and experience, I think there's something I could offer to the profession as well. Do a lot of teaching to fellow dentists.
Oh, that's wonderful that you do teaching here too. But you're quite the adventurer. So after you graduated dental school, you joined the military.
Yeah.
So why did you join the military? Where did you go? What was that like?
So I've taken, my career has actually been fairly unorthodox, quite not the traditional route. So I got a scholarship while I was in dental school. And so I made that decision primarily on two reasons. One, to get the mentorship and the grounding after graduation. So usually there's fairly robust training for new graduates, for new dentists. So you're paired with a senior dentist. They make sure that you focus on quality, not on the business aspects or on the money side, and just purely focus and hone your clinical skills in a setting that is purely service-based. So like you're serving military personnel. So all your focus is doing the best work for the soldiers. And so I thought that was an ideal learning environment as a springboard for a career. So I had to focus on the money side or the business side, or trying to, there's an endless supply, like there's plenty of soldiers. So you're quite busy as a clinician. But at the same token, I always love to travel, and I thought it was a nice blend. You get to travel, albeit it's not for leisure, but it's for work. You're serving the country.
I mean, you went to Iraq, right?
Yeah. So I was fortunate to be called to to deploy to the Middle East and a few other operations, and that altogether was, to me, as a single person straight out of dental school, I thought it was ideal. You get to travel, experience new things, and get military training, which is quite rare, and also hone my clinical aspects. So I thought that was a nice few foundational years while I could get to serve the country as well.
Yeah, wow. And how do you think that impacted the rest of your career?
So it definitely got me beyond my comfort zone, and you really got to know that there's no limit. So before the military, the way that they trained you is that they really break you down, all right, and then really test where your limit is, and then you figure out you can even go way beyond. So it really opened my mind that nothing is an issue. You can always find a way to problem solve, planning, and sky's the limit. So that, with an adventurous spirit, really there's a lot of opportunities that can go your way. So those few years really got me thinking globally. I wasn't restricted to just Australia, and I was a lot more open to venturing overseas. That was never an issue afterwards.
Was that your first time going overseas?
I traveled when I was young, and it's called the travel bug. So I always loved to explore the world, and but especially after the unique experiences of being in the military and the chances you can actually travel quite a bit within Australia and beyond. And it just got the mindset. I think the important thing was the mindset, was just think broadly outside Australia, and that paved the way for obviously my career over in the States and now in Vietnam.
Okay. Yeah, I can imagine you'd have to be quite brave to be able to do all of that and then end up doing a business here out of all things. And so bringing it back to Vietnam, what is dental healthcare like in Vietnam? Like, what is the current status of it?
It's exciting. Things that are happening in Vietnam in general. So I mentioned earlier where Vietnam is the fastest growing middle class, affluent class in this Asia Pacific, Southeast Asia region. And being a developing country, they do have a public health sector and also private. Public health isn't that well resourced, so the services are very, very basic. They do offer, I think, through the National Health Insurance Scheme, very basic preventative emergency care, if that. And basically here it's more non-insured sort of model healthcare, where you just have to self-pay. And you have to seek either the hospitals or whether private clinics. And we're seeing now, as we're seeing with globalization, where things are more accessible on the internet, doctors, dentists in general, they're being able to access knowledge. They need to update their skills, knowledge, expertise, as opposed to 15, 20 years ago or beyond. And so I think the quality of dentistry in Vietnam is definitely increasing, where the people are willing to invest in themselves and also in the clinics. So we're seeing a revolution of sorts, that the more reputable clinics, the more high-end clinics where they're willing to spend the money to invest, you're seeing the facilities, it's top-notch, like second to none compared to the clinics that I've seen back in the States or in Australia. And I think that's something that needs to be disseminated to the broader sort of international audience, that healthcare standards are increasing. You do have your smaller clinics, mom and pop shops, where the standards are still fairly ordinary by Western European standards. But the more affluent, established, reputable clinics, they're really going out of the way to really invest in terms of facilities, equipment, materials, expertise. People are willing to travel overseas to upskill. So I think that's great for the local population, and also for foreigners and dental tourism.
Yeah, I think so too. And just to kind of illustrate for some of our listeners, like, I'm from Albuquerque, New Mexico in the States, and I would go to the local dentist's office, and they're kind of small, like normal kind of places. Versus if you go to Premier Dental, especially the Taodean one, it's in a big villa. It's got gorgeous facilities, all the most like modern equipment. It is like way nicer, honestly, than anything that I've seen in the States. And so that's really something that I guess not a lot of people know about dental care in Vietnam.
That's right. So I think like anything, if you need to, whether you're local or in another state, another country, you need to do your research, do your due diligence, and just find out more about the clinic, the local, like the doctors, the bio background, and you'd be surprised. And it's across the board. It's not just Vietnam, and just a bit of research goes a long way, and you'd be surprised. There are some individuals where they get extensive training. You need to sort of sift through. There are a lot of people who do the short courses, but there are some that actually done substantial, like overseas training, and it's worthwhile to pursue, find out those individuals. So you can get the best of both worlds, like the expertise of seeing a doctor or dentist at the similar level that you would expect at your home country. But if you went to a developing country like Vietnam, then obviously the fees, the prices are definitely a lot more reasonable.
Yeah. And so how do patients choose where to go? How do they know about like these top-notch kind of facilities?
So most clinics would heavily invest in marketing. So obviously to get the name out there online. Our clinic relies a lot more on word of mouth. So we've been established for quite a long time, like close to 20 years. So we've got a solid patient base. But then obviously we're always adding to that, and the word's getting out. Obviously that I'm getting more established here in Vietnam. So just by purely word of mouth, there are words spreading about my team in Ho Chi Minh City. Yeah, so usually through social media, and it's basically just like spreading sort of within different forums and groups.
Okay, so word of mouth, and also that digital word of mouth. I see you guys also are pretty active online.
Yeah. So we're tapping in with the social media, just trying to be accessible to where potential patients can be seeking information. Mm-hmm.
Yeah. And so what do you think are the biggest issues affecting normal patients when they're trying to access dental care?
In Vietnam?
In Vietnam, yeah.
So I think it's cost is always a barrier, and quality also goes hand in hand with the fees. So obviously everyone deserves to access quality healthcare, I believe. And it's a matter of just trying to sift through, because there's many clinics, and it's really confusing not knowing where to go for particular situation, because everyone has different needs and different illnesses and conditions. So it's a matter of like going online, trying to do the research, asking around. And there is also a bit of luck as well, like who you meet, how they guide you, and where they refer you to. So yeah, I think it comes down to individual research and just being diligent with trying to access as much as possible. And hopefully the clinics and the doctors, they have some presence online to be able to access the information that you need.
And what are some typical issues that you see? And I know that Premier Dental has some pediatric dentists in particular, and that area is a bit underserved. So can you kind of talk about this?
Yeah, so we've our team we focus on, in addition to the general dentistry and all the popular areas of clinical needs, we've focused a lot on pediatrics, which doesn't get much attention in general in Vietnam.
Why do you think that is?
I think it's the mindset, the mentality. Vietnam is evolving, so they used to, during the tough times, obviously it's more cure, emergency-based care. Now that people have a bit more dispensable income, obviously they're more focused on health. And so now dental, oral health care is definitely at the forefront, particularly with younger families and then they have kids. So obviously they're more attuned and say, okay, like our kids need the care. And so they're seeking out proper healthcare. Like obviously most dentists are capable of treating kids, but kids need an extra, like it's quite difficult to manage behaviorally, like psychologically.
Yeah.
Plus if they have high needs, you definitely need specialty training. And so we've, especially at our new branch, we've really gone out of the way to make it more accommodating, kid-focused, kid-friendly, because we want to start off the whole general mindset and positive experiences earlier on, because we definitely know, and research shows that it definitely influences your life decisions and onwards into adult life. So we want to obviously take care of the kids' needs in the immediate space, but then also we want to encourage like positive, lifelong habits, and that starts off when you're young. So we definitely have a team that we're recruiting, that we have on staff that can take care of kids, and so yeah, definitely the pediatric space we definitely emphasize, and we're proud of that. And also as a periodontist, gum disease, which is really rampant and prevalent in Vietnam, then I can definitely feel that space as well, because we just lack the healthcare professionals that actually do specialize and can actually address the periodontal, like the gum disease issues, which is the core cornerstone of oral health.
I see. So in Vietnam, is there higher rates of periodontal disease than other places?
Yeah, in Vietnam with public health, there's not much data compared to, let's say, in the Western countries, but the most recent, which is probably like 15, 20 years ago, the figures are quite astounding. It's like over 75%. So 3 out of 4 adults have undiagnosed or untreated periodontal gum disease. When you compare that to Western countries like the States or in Europe and Australia, where it's hovering around the 50%, which is still quite high, but you can see that definitely the difference, and and that really causes other issues like tooth loss and quality of life for a lot of the adult population here in Vietnam.
And why is the incidence so much higher here?
It comes back to health awareness or healthcare, even at the basic level, access to care. People have other priorities, like trying to put food on the table. So obviously their own health is placed low on the priority list. So there's a bunch of social economic factors, demographics, genetics plays a role, and also definitely habits, smoking. So when you combine that all together, obviously it definitely affects the prevalence of periodontal disease in developing country like Vietnam.
How is education and awareness around periodontal disease here?
It's pretty low, and amongst the population, and even amongst the healthcare professionals. So in the medical community, even the dental community, people don't really give enough weight to it, which they should, because it's difficult to manage. It's not popular. It's time consuming, and obviously doesn't pay well. So people would definitely focus on other services which have quicker turnaround. It's quicker results. So gum disease is very difficult to manage, and it's a long term. It's a chronic disease, so it's just ongoing care, which in a developing country like Vietnam, in private practices, it's very easy to turn a blind eye to that and just focus on and other services.
Yeah, well, it's so interesting that I guess it's a little bit cheaper than other services, more difficult to treat, and so they focus on other things. I see from our service list on Docosan too, a lot of people focus on implants or orthodontics and stuff like that. So there's a bit of a financial incentive.
That's right. So implant dentistry is very popular and a lot easier, but then you've got to be careful because if you place dental implants in someone who's prone or has gum disease, then you're going to find that the gum disease doesn't go away. It's going to affect the implants as well. So over time, we're seeing, because dental implants is established, it's nothing new anymore. It's been around for 40, 50 years. And we're going to and we're seeing already that dental implants that have been around for like 10, 15, 20 years, you're getting a lot of issues. So as a profession, we're definitely seeing some of the ugly side to the treatment, and hopefully that swings the pendulum back so that people are a bit more cautious and a bit more thorough when it comes to case selection and treatment and recommending whichever therapy the patient needs.
And what do you think is the biggest thing that we can do, or that you as clinicians can do, to address the issue of low awareness and treatment of those periodontal diseases?
I think there's quite a few facets to that. I think we, as a profession overall, we should be lobbying to the government. At the very least, we should just try our best to, as a whole, the dental association, the dental field, we need to voice these issues. At least at some policy level, there's some attention given to it. Then at the dental school education, while we're training, the basic training, there needs to be a lot more emphasis to start off as we train this new generation, these following subsequent rounds of graduates, that they need to pay more attention to these core oral health issues, and hopefully that's a springboard to better comprehensive care for the community, and also to existing doctors, that they can't ignore these core health issues, and hopefully we can hopefully move in the right direction. It's gradually getting there, but it's a difficult thing, and hopefully it takes a few individuals who are passionate about let's say periodontal disease to help hopefully inspire and encourage fellow colleagues to pay more attention, or at the very least refer them to people that can actually handle these issues.
Yeah, well, I know you're doing a lot of training in dentistry and hopefully some advocacy yourself. So that's great. And then when it comes to new tech and more advances in oral health, what are you excited about?
So dentistry is at this cusp of, it's like a revolution where digital dentistry is basically taking over. So a lot of the techniques did in the analog way and the traditional way. So it's gradually being replaced by digital technology. So which is a lot more efficient, more accurate, definitely a lot more pleasant for patients. And then we're having computer generated like design, CAD/CAM is so computer aided design and manufacturing of prostheses, teeth. That's getting pretty commonplace now. And also I'm very excited with artificial intelligence. So AI is really coming around. So I think over the next sort of 10 years or so, that's coming to the dental field, particularly initially with diagnostics, imaging. So we get more standardized, accurate diagnosis, and hopefully from there algorithms to help recommend different treatment modalities. And so hopefully that starts to standardize and levels out the playing field and the quality, where sometimes doctors may misdiagnose or miss something. So hopefully that's where AI can come in with basic diagnosis and coming up with treatment plans recommended. So obviously the doctor still has to have the final say. And we're also seeing innovation in surgery, where using technology to help navigate, so more precision, less human error when it comes to oral surgery. So that's been around for a few years now, but definitely over time that's going to be more commonplace. So it's very exciting times. AI is definitely making its mark in dentistry, and that's definitely going to elevate standards and qualities overall.
Awesome. I'm so excited to see what AI brings to healthcare as a whole too. Well, Albert, thank you so much for this. This was a really interesting conversation. And so for our listeners, you can find Dr. Albert on Facebook and on Docosan. Links will be in the description. So thanks for joining us, and tune in next time for Demystifying Healthcare in Vietnam.